before. They've not tested positive. To them, it comes like a shock. How is it possible? And then they keep checking themselves every day. Some will now go outside and do the test, not in the hospital. They go to the place, go and check it. Maybe hospital they didn't want to tell me the correct thing. They'll go to this place, they'll check. They'll do it at home, still positive. Wow. Then gradually, after 2 weeks, when they come for their ultrasound scan, it is when they actually see the heartbeat. They'll say, hey, so I'm really pregnant. I'm not feeling anything. I hope this pregnancy is doing well. Is doing well. People react differently to hormones. The hormone of pregnancy that women react to is that what they call HCG, the human chorionic gonadotrophin. So that is what gives you all of the pregnancy symptoms in the first trimester: the nausea, the vomiting, the weakness, the tiredness, all of those things. So women react differently to that hormone. All right? So it's perfectly normal. So, number two, is this nausea and vomiting normal? You know, there are women who have nausea and vomiting. Next slide. Nausea and vomiting in another level. Okay? So you need to understand that nausea and vomiting is common in pregnancy. All right? You're feeling nauseous, you're brushing and then you vomit, and then that's all. You're always feeling this nausea. But when it becomes excessive, when you cannot tolerate anything, anything you take in comes out. You cannot eat at all. You can't even drink water. You take water, anything that goes in comes out. Then that is not normal. That is what we call hyperemesis gravidarum. Now, once you're having that, you have to be admitted in the hospital. We need to break that chain, that circle. We need to give you parenteral injections to stop that vomiting and make you take something. Because if it goes on unabated, it can lead to some other consequences. Because then you can't take anything, you become severely dehydrated. Before you know, you start cramping. Before you know what's happening, you may lose the pregnancy. Feel very weak, become acidotic. All right, so you're admitted in the hospital, you're given antiemetics, and then the vomiting stops, you're able to tolerate, and then you go home. Now, this usually will happen for women who are carrying their first pregnancy, for women who are carrying multiple pregnancies. All right, and women, it may not be your first, and you may have it. You may be carrying just one, and then you have it. It all depends. All right. But once you see that you're vomiting excessively, then you need to come into the hospital. All right. So the next slide is I'm always feeling sleepy and tired. Is it normal? You know, that woman who will say, since I got pregnant, I can't do anything. I just feel useless. No energy at all. I'm always feeling sleepy. So when I manage to go to office, you sleep. It's normal. Normal. It's normal. It's pregnancy. That's why a pregnant woman is called a fourth being. You know, they are different, they are unique. And every woman has a unique experience. But in each pregnancy for that same woman, the experience will be different. All right? So, it's one of the symptoms and signs of pregnancy. It's usually due to the pregnancy hormones. But like that thing they call HCG. It's a very funny hormone. And it's only produced when you are pregnant. So that is the pregnancy that we test to show that you are pregnant. It's the baby that produces it. All right, so it's normal for you to feel sleepy, to feel tired, lack of energy, always want to feel sleepy, particularly in the first trimester. By the time you get into the second trimester, you tend to get better. In fact, what normally happens is that the way patients describe it is that they sleep one day very pregnant, they wake up the next day very normal, as if they are not pregnant at all. All of those pregnancy symptoms will just disappear. All right? It's because the effect of those hormones have waned. All right, so next, is this abdominal cramps normal? I'm always having these cramps, feeling cramps here, feeling cramp there. Is it normal? Should I be worried? Hey, I hope it's not that I'm losing the pregnancy. Oh. Should I come to the hospital? Should I be admitted? All right. So it's abdominal cramps normal. So mild abdominal cramps is normal in pregnancy. Mild, just some pains here. It's not regular. Just comes and goes. As the pregnancy is developing, your uterus is small like this. Something is growing inside, so you're bound to have some bit of expansion, a bit of cramps here and there as it's expanding. So uterus is growing, all the things around it trying to hold it, they're also expanding too. So you're bound to have some bit of cramps. And these cramps can start from as early as implantation period. So even when after you've had your transfer, you begin to have cramps here or there. It's okay. But what we ask you to do is to just take supplement, sorry, take fluid, and just rest, and then you'll be fine. So mild abdominal cramps, it's okay, okay. But if the abdominal cramps is severe, come very severe, particularly if it's associated with bleeding, that one is no longer normal. What that therefore means that possibly you may be having a threatened, the pregnancy may be threatened. I mean, you will probably be having a miscarriage. All right. So sometimes if you're having those mild abdominal cramps, it may be due to fibroids, adenomyosis, or you may having a UTI. So once you start having all those repeated cramps becoming severe, you need to come to the hospital so that you'll be treated. All right. Want to investigate why you are having those cramps. So one of the things we tell you to do, like I said, take a lot of fluid. Don't get dehydrated. Because once you are dehydrated, dehydration can cause cramps. Because the center that controls the release of oxytocin, that brings about contraction in women when you get to term for baby to come out, is also the same center that regulates your water intake, ADH. So once you are dehydrated, that on its own can trigger the release of oxytocin. So we tell you to please ensure you take water. That's very good. Our patients who they come to this class, they must come with a bottle. Your bottle is inside your bag. Very good. I can see that on two there. In never any shape or form it comes in, it's fine as long as it's water or it's fluid. It's good to ensure that you are well hydrated. All right. So the next is I am seeing blood. Is it normal? So is it normal to see blood in pregnancy? I know that this is one thing that women they don't want to see at all. Hey, once they see blood, I say, God, what is this? Oh, doctor. Start running to the hospital. I have seen blood. I've seen it. Calm down, calm down. So it can be very scary. Hmm? No pregnant woman wants to see blood in her vagina at all. All right. So it's not usually normal for you to have vaginal bleeds during pregnancy. It's not normal. All right. So once you have it, then it's something we need to investigate. However, very early in pregnancy, particularly for women who went through IVF, when you have a bit of spotting during that period when you are waiting between when you had your transfer and when you're going to have your test done, you have a bit of spotting. It could be implantation bleeds. All right, so you don't really need to be worried. But if it becomes like it moves from just spotting to bleed, then there's a problem. Okay? And then when in your first trimester you start bleeding, then that could be a challenge. It means that probably that pregnancy is being threatened and then leading to miscarriage. And when you now bleed in advance, you've gone to second trimester, third trimester, and you are bleeding. Then it could be that either you're having a placenta previa, that is low lying placenta, or the placenta is separating before time. None of them is good. So if it's just a bit of spot, no problem. But once you start bleeding, frank blood, red blood, and any time during pregnancy, that is not good. So for that you have to come to the hospital to be checked out. All right. Next, my appetite has not increased. Is it normal? I'm not eating. I thought they said when woman is pregnant, she just eats like just be eating. I'm not eating. In fact, I don't even like eating at fast. If I once I see food, I just get angry. Is it normal? Because I think I'm supposed to be eating times two, times three because I'm. So what you need to understand that women's appetite varies. Some women in their first trimester they will eat and eat anything.